West Nile virus is a serious health concern. Originating from Africa, it has now spread to many parts of the world, including North America, Europe and Asia. This virus is primarily transmitted through the bite of an infected mosquito, making it a seasonal epidemic in many regions. It's a virus that can infect humans and animals. Birds are the primary hosts, but the virus can also infect horses, dogs and other mammals. This cross-species transmission is what makes it particularly challenging to control. Most people who get infected don't even know it. They might continue with their daily routines, unaware that they are carriers of the virus. This asymptomatic nature of the virus contributes to its rapid spread. They have mild or no symptoms. In fact, about 80% of infected individuals show no signs of illness. For the remaining 20%, symptoms can range from mild flu-like symptoms to severe neurological conditions. However, some people can develop serious illness. These severe cases can lead to encephalitis or meningitis, which are inflammations of the brain and surrounding tissues. This can result in long-term neurological damage or even death. This makes West Nile virus a significant public health challenge. Public health officials are constantly monitoring outbreaks and working on strategies to control the mosquito population and prevent the spread of the virus. We need to understand the virus to protect ourselves and our communities. Research is ongoing to develop better diagnostic tools, treatments and possibly a vaccine to combat this virus. West Nile virus is a type of arbovirus. Arboviruses are a group of viruses that are transmitted by arthropods such as mosquitoes and ticks. These viruses are responsible for a variety of diseases in humans and animals. Arboviruses are viruses spread by insects like mosquitoes and ticks. The life cycle of these viruses involves both the insect vector and the vertebrate host, making their control complex and multifaceted. These viruses can cause a range of illnesses, from mild fevers to severe encephalitis. The symptoms can vary widely depending on the specific virus and the individual's health condition. West Nile virus, unfortunately, falls into this spectrum, making it a public health threat we need to address. Public awareness campaigns, community health initiatives and ongoing research are crucial in our fight against this virus. By staying informed and taking preventive measures, we can protect ourselves and our communities from this growing concern. West Nile virus was first discovered in Uganda in 1937. This discovery was made by researchers who were studying the transmission of yellow fever. They isolated the virus from a feverish woman in the West Nile district, hence the name. The virus was initially considered a minor pathogen, causing mild illness in humans and animals. For many years it remained primarily confined to Africa, Asia and parts of Europe. The virus circulated among birds and mosquitoes, occasionally infecting humans and horses. It was not seen as a major threat outside these regions, and outbreaks were sporadic and relatively contained. However, in 1999, the virus made its way to New York City. This unexpected appearance marked the first time West Nile virus was detected in the Western Hemisphere. The initial outbreak caused significant concern among public health officials and the general public. This marked the beginning of its spread across North America. Over the next few years, the virus rapidly expanded its range, moving from the east coast to the west coast. It spread through the movement of infected birds and mosquitoes, facilitated by favorable environmental conditions. The virus likely arrived through infected birds or mosquitoes transported through international travel or trade. Birds, particularly crows and jays, are highly susceptible to the virus and can carry it over long distances. Mosquitoes become infected when they feed on these birds and then transmit the virus to humans and other animals. Since then, West Nile virus has become endemic in North America. This means the virus is now regularly found in the region, with cases reported every year. Public health officials have developed surveillance and control programs to monitor and reduce the impact of the virus. It causes seasonal outbreaks, primarily during the summer months when mosquitoes are most active. People are advised to take precautions such as using mosquito repellent, wearing long sleeves, and eliminating standing water where mosquitoes breed. Despite these efforts, West Nile virus remains a significant public health concern, highlighting the ongoing challenge of controlling mosquito-borne diseases. Most people infected with West Nile virus experience no symptoms. This makes it tricky to detect. However, about 20% of those infected develop West Nile fever. This illness typically manifests with flu-like symptoms. These symptoms include fever, headache, body aches, fatigue, and sometimes a skin rash. These symptoms are caused by the body's immune response to the virus. As the immune system fights off the infection, it can trigger inflammation, leading to these uncomfortable symptoms. West Nile virus spreads primarily through the bite of infected mosquitoes. These mosquitoes become carriers after feeding on infected birds, which serve as the primary hosts of the virus. When an infected mosquito bites a human, the virus enters the bloodstream. It then replicates, potentially leading to illness. While mosquito bites are the most common route of transmission, West Nile virus can also spread through blood transfusion, organ transplantation, and from mother to child during pregnancy or breastfeeding. However, these modes of transmission are less common. Section 5. Facing higher risks. Who's most vulnerable? While anyone can get infected with West Nile virus, some groups face a higher risk of developing severe illness. Older adults, particularly those over 60, are more susceptible to serious complications. This is because their immune systems may not be as robust in fighting off infections. Individuals with weakened immune systems, such as those with HIV/AIDS, organ transplants, or undergoing chemotherapy, are also at increased risk. Their compromised immune systems make it harder to combat the virus effectively. Section 6, Diagnosis Decrypted, Identifying West Nile. Infections diagnosing West Nile virus can be tricky. This is because its symptoms often resemble those of other common illnesses, such as the flu or other viral infections. Patients may experience fever, headache, body aches, joint pains, vomiting, diarrhea, or rash. These symptoms can vary greatly in severity and duration, making it challenging for healthcare providers to pinpoint the exact cause without further investigation. Doctors rely on a combination of factors to make a diagnosis. They start by considering the patient's symptoms and medical history. This includes asking about recent travel to areas where West Nile virus is prevalent and any known exposure to mosquitoes. They also look for signs of mosquito bites, as these can be a key indicator of potential exposure. Additionally, doctors may inquire about the patient's outdoor activities, especially during peak mosquito season. To confirm the diagnosis, blood tests are used to detect antibodies specific to the West Nile virus. These tests are crucial because they provide concrete evidence of the infection. These antibodies are proteins produced by the immune system in response to the infection, and their presence helps confirm the diagnosis. The process involves taking a blood sample from the patient and analyzing it in a laboratory setting. The lab technicians look for specific markers that indicate the presence of West Nile virus antibodies. This detailed analysis is essential for an accurate diagnosis, as it differentiates West Nile virus from other similar illnesses. Once the diagnosis is confirmed, the healthcare provider can discuss the next steps with the patient. This may include treatment options, preventive measures, and ways to manage symptoms effectively. Early diagnosis and intervention are key to managing West Nile virus effectively, ensuring the best possible outcome for the patient. Section 7, Navigating Treatment, Managing West Nile Virus. There is no specific antiviral treatment for West Nile virus infection. Most cases are mild and resolve on their own with rest, fluids, and over-the-counter pain relievers to manage symptoms. However, severe cases requiring hospitalization may involve supportive care. This includes intravenous fluids, respiratory support, and close monitoring to manage complications. Section 8, Prevention is Key, Staying Safe from West Nile. Preventing West Nile virus infection revolves around avoiding mosquito bites. This involves using insect repellent containing DEET, wearing long sleeves and pants when outdoors, especially during dawn and dusk when mosquitoes are most active. Eliminating mosquito breeding grounds around homes is crucial. This includes removing standing water in containers, cleaning gutters, and maintaining swimming pools. Section 9, Outlook and Hope. Living with West Nile virus. The outlook for most people infected with West Nile virus is positive. Most experience mild or no symptoms and recover fully. However, severe cases can lead to long-term neurological complications. Understanding the virus, taking preventive measures, and seeking prompt medical attention if symptoms arise are vital in minimizing its impact. Awareness and prevention are our best defenses against West Nile virus.